Good afternoon, this is Dr. Do again. This video is an alphabetical list of problems. We're on, I started with from A, finish A, B, and we're on C. I will start, today I'm going to talk about the colon cancer. It is quite common, actually, for colon cancer, prostate cancer, breast cancer, the other most with highest incidence rate worldwide. So colon cancer is any diagnosed or undiagnosed situation that related to the colon cancer that warrant emergency visit, bleeding, perforation, blockage, which is the intestine obstruction. So if this bleeding either usually bleeding is from rectum, depends on the location. Usually, if really locating the rectum or at the end of colon, so it should be the bright red. But if it's upper colon, could be darker, like the dark red or black even. So these are the emergency if you have a large amount of blood per rectum, so you need to see the emergency. Or the perforation, suddenly you feel the abdominal pain, like bursting pain, and very painful, cannot touch it. You guarded your abdomen, bend it over to comfort the pain, to make the pain feel better, elevated the pain. So that's another emergency, means the cancer and also the inflammation on the wall of the colon cause the perforation. That's emergency. Or blockage. The cancer is growing too big, or the cavity of the colon becomes narrowed. Either the stool or the cancer itself block the passage, so cause the obstruction. That is another situation you need to see the emergency room. So this is the other than that, regular preventive is very important. Let's talk about the colon cancer. What are the risk factors? You probably know it. Genetic, of course, family history, and colon polyps, which is the small mucus growth, could be different shaped. Could be benign, but eventually it's undergoing the malignancy change, so become the colon cancer. Or lifestyle, the bowel habits, that plays an important role. High fiber diet, low fat diet, and that's really a help to prevent colon cancer. In terms of the screening, you probably know it. Usually, general population without family history, there are very varied form of family history of colon cancer. Either start early or start at middle age. Regularly, normal general population, 50 years old, start either every 10 years for the colonoscopy, or sigmoidoscopy every 5 years. Plus fecal cord blood test. So these are the regulation for the screening. So for the preventive, in terms of you visit your physician regularly, the physician will bring this up, so you discuss, you detail the family history. And there's some other colon disease increase the risk of colon cancer, like colon ulcerative inflammatory bowel disease, including the ulcerative colitis and Crohn's disease. Those are usually tend to occur in some special group of people, and also the infections, probably some subtle infections cause the chronic inflammation. That's what I should say. Chronic inflammation also increase the risk for the normal mucus cell of the colon undergoing the chronic change. might impose the risk for the colon cancer. In terms of the CEA, which is cancer embryonic antigen, I think the significance for this monitoring the recurrence or the chemotherapy, how the drug, the therapeutic monitoring, especially for the recurrence. So, for example, if you have colon cancer, you were undergoing the surgery, the cancer was removed, and you were taking the chemo or the radiation therapy, and the CEA is used to follow up whether you have the recurrence, whether the cancer progression. So this is in terms of screening, CEA probably not specific because many other conditions can have the CEA elevation. Doesn't mean it is the cancer. So this is for the colon cancer. What are the how is the colon cancer diagnosis? What is the presentive symptoms? Usually, the early stage, pretty much not symptomatic. You do not feel any special, unless you have the other disease like the colitis or Crohn's disease, you feel abdominal pain. Other than that, if the colon cancer starts from the polyps, for example, really there's could be symptomatic, or with time passing by, you probably feel tired, losing weight, or probably you have the fecal cord blood. So which means it's not you cannot see it. Only use a special test to diagnose there's some blood in the stool. So these are so the colon cancer diagnosis mainly rely on the preventive. So do the regular follow-up with your physicians and do the scope to identify whether there is some polyps or whether there is some precancerous changes. So then can give you idea whether you have it or don't have it. So and then start early to treat it, to prevent it. So this is for colon cancer. In terms of metastatic colon cancer, it could happen. For example, the majority metastatic colon cancer is from liver. The liver cancer with the blood, because the portal vein connected to the intestinal system. So the hepatic liver cancer could metastatic to the colon. If that's the case, you probably already know you have colon hepatic cancer, or you do not know until the colon cancer was identified. Find out the original was not from colon but the liver. So this is another scenario for related to the colon cancer. So the take-home message for this episode, for this video, you probably know it because it's so common, especially for those who have family history or past chronic colon disease. Do the regular physical and do the scope regularly, and keep a good bowel habit. Particularly if you're getting older age. I'm not talking about the young 20s or for young people, unless you have the special form of the family history. If you have it, you probably already know it. Physician already tell you start the scope at an early age, like 12 or even 20 or even 12, you should start out. But those are for the special group of people. If you're that group, you probably know. But other than that, just regularly follow up a good bowel habit, especially when you're getting older, 40, 50 years older. Keep the high fiber. It's good to start young, but I know for young people, probably it is hard because you manage your life, busy, you just grab food you like and grab food convenient. When you're getting too older, you need to pay attention to your health. So then eating health, exercise, good habit. So that is the taking home message. And follow the physician's advice, do the scope at a certain time and to diagnose and also to identify, particularly if you have family histories. So this is the message about the colon cancer. In terms of treatment, that will up to your physician, usually diagnosed and follow up with the oncologist or radiation department. So that is the professional level management. So I'm not going to talk that today. Because I encourage you to talk to your physician, follow up with your specialist or primary care for that part, and comply with them with their advice. All right, thank you for watching, and I will see you next time.